Did you know the average chance of a woman being diagnosed with cancer in her lifetime is about 1 in 40? Among cancers in women, endometrial cancer accounts for about 13% of cancers. My grandmother passed away in 1998 of endometrial cancer, not knowing she was at risk because cancer did not run in our family. She passed away 4 years after being officially diagnosed. Had she been informed about the disease, early prevention and treatment could have saved her life. Endometrial cancer is a disease that is both curable and preventable. The National Cancer Institute estimates that in 2011 in the U.S. alone, 46,000 new cases of endometrial cancer will be discovered, and among those there will be 8,000 deaths. Endometrial cancer is a curable cancer. Knowing the facts about this cancer, the better we can prevent it and treat it. In the next few minutes, I want to talk about endometrial cancer and how it develops, the signs and symptoms to look out for, the risk factors, and prevention methods, and finally, which treatments are available. So what is endometrial cancer? Endometrial cancer is a cancer that develops in the uterus. This is a picture of a woman's uterus, and it's the center right here in the middle. That is the uterus. The uterus is a hollow, pear-shaped organ in the female reproductive system. Endometrial cancer can form here in the middle in the uterus. It's actually an uncontrollable growth of cells that invade and cause damage to the surrounding tissue. So this is what it would look like here. You see the uterus before here, hollow, there's nothing inside. And then you see it here when it has started to evade in the uterus. You can see the cells, have they started to enlarge in the hollow area. Okay, so now that you know how and where in the body of a woman this cancer develops, you should make an appointment with your doctor if you experience any of the following signs or symptoms. Some of the signs can be vaginal bleeding after menopause. So menopause usually occurs in women that have reached the age of 40 or beyond. So if you're bleeding, then that would be abnormal. Another sign to look out for is prolonged periods of bleeding in between periods if you haven't begun menopause yet. And then also you can experience an abnormal watery or blood-tinged discharge from your vagina. Some of the symptoms that you may experience, some pelvic cramping in your lower abdominal area. You might experience pain during intercourse, something that's not normal. And then another symptom would be abdominal pain, unusual abdominal pain. Those are some of the signs and symptoms you need to look out for. So, now that we know the signs and symptoms to look out for, if diagnosed, the doctor should discuss risk factors and ask questions about your family's medical history. Some of the risk factors are estrogen. Estrogen needs to be balanced by progestin. Another sign to look out for is if it runs in your family, if it's hereditary. If somebody in your family has had this cancer before, you're more increased to develop this cancer yourself. Body fat also plays a part. Richard Belavois, PhD, and Dennis Gringas, PhD, they're the authors of Food That Fight Cancers, and they state that obesity is considered today to be responsible for 60% of deaths caused by endometrial cancer in women. Okay, so some of the prevention methods, using birth controls that contain both progestin and estrogen, because estrogen needs to be balanced by progestin. Another thing you can do, if it is hereditary, you see your doctor regularly. The earlier this cancer is caught, the better it can be prevented and treated. Um, and another way is to exercise regularly and eat a healthy, balanced diet. You should avoid foods that are high in animal fats. Instead, replace them with natural fats. Natural fats can be found in fish. And then you should also eat a combination of fruits and vegetables, eating plenty of those daily. In the event that cancer has passed the point of prevention, the choice of treatments will depend on the stage of cancer and overall medical condition of the patient. One of the treatments available is surgery. The purpose of the surgery is to first stage the cancer and then to remove as much of it as possible. And most women will have cancer at some point in time with this disease. Another thing most women will have to have is a hysterectomy. This will actually remove the uterus and also the fallopian tubes, these here on both sides, and as well as ovaries here. Having a hysterectomy will remove all those from the reproductive system. Another option available is radiotherapy. Radiotherapy uses a high energy rays, and they're similar to x-rays, and those help kill the cancer cells as we see here. The chemotherapy would then kill these off. This type of radiotherapy is usually offered after an operation as an adjuvant to the surgery. It also decreases the reoccurrence of this happening and is used as a combination for the surgery and radiation, which produces the best results. Another thing is chemotherapy, which is an anti-cancer drug, and it's used in the advanced stages. So during this speech, you've learned how and where cancer develops, the signs and symptoms one may experience with this disease. We found out who is at risk, what we can do to help prevent this disease from forming, and finally the treatments that are available. Knowledge is key to assist in preventing and curing endometrial cancer. If you are at risk or you know a woman who is, educate them about this type of cancer and urge them to make the necessary lifestyle changes to prevent this cancer. It could potentially save their life one day. Thank you.